All right, sir. Clearly, as everyone can see, you got some serious issues going on. Can you fill us in? What's going on?
Um, I think I woke up one morning and I couldn't walk. The pain was severe. I tried to get up as a man, but the pain became so consistent that I had to stop doing the regular exercises that I usually do. But now I see I can hardly bend over to my left. Neither can I bend over to the right. I only use my right side to carry some little things that I know I could carry, and sometimes even the bar movement, it's a difficult thing for me to do. And I think it's just 2 days ago that I kind of like got a little relief, and that was why I followed you. My friend followed you on Facebook, and he recommended that he brings me to your place, and that was why I happened to come here today.
Okay. All right, sounds good. Also, does the low back pain, does it stay right there or does it travel down to your legs?
Yeah, it traveled down to my left leg, from my
Left
thigh,
leg.
yeah, all the way down to my Achilles.
To the Achilles.
Yes.
All right. Any other issues going on as well?
Yeah, I figured out that for the past two weeks, the finishing part of me is been a kind of like censored. It doesn't really go down smoothly the way it used to be, and I had to take a break on that aspect. So
Understood.
yeah.
Understood. To clarify to the viewers, what we're talking about is, when the patient and his wife have, the spousal relations, they've been having some difficulty finishing that department. So, all right, let's start piecing everything together. Let's take a look, see what's going on. Go ahead, have a seat. The most trouble is you have no problem sitting down, but getting out of the chair is a problem?
Yeah, sometimes I think last week was a difficult thing for me to sit down because my brother has been the one helping me out when I try to sit down. And if I sit for long, like 20, 30 minutes, I'll definitely need the stick for me to get up. And eventually, if I'm standing up, I always use my right side because I figure out that I've put too many pressure on my left side, and most of the exercise, like getting up from the bed, the chair, I always do on my right side.
Gotcha. Can you try getting out of the chair right now?
Without the stick or with the stick?
No, go ahead with the stick if you need to. Okay, so clearly, it's a struggle. Okay, go ahead, have a seat. Let's take a look. So, as we saw in terms of his walking gait, he constantly try to do a left lateral flexion. In other words, when you have a herniated disc over here, and we see over here, his spine is already leaning towards the left. So basically the nucleus pulposus, which is like a ball bearing, is shifted over this side. That's why he's trying to lean away from the pressure itself. And that's what we saw when he was walking. He was trying to lean everything away from the right side. Okay, that's what's taking the most pressure off of this. Now, in addition to it, that's why I was asking about during the consultation, the history, that the pain's radiating down to his left Achilles. So in the left Achilles tendon area, that's typically a sacral nerve involvement. Now, on top of all that, now there's also, he has difficulty finishing in terms of when he's doing his relationships with his wife. So therefore, what happened is that usually neurologically wise, that's also sacral nerves. So we're going to take a closer look, see what's going on. And already, just seeing from here, okay, we have see some swelling over here. But what's with all this puffiness way down here? Okay, so there's a lot of puffiness on this left-hand side over here. That shouldn't be there when you compare to the right. And even the right side is so puffy and swollen here. So that's what we're going to take a look, see what's going on. Now this instrument over here, it's going to confirm what we have already have a good idea what to focus on. Now, because when there's a damaged tissue and it starts that inflammatory process, as we saw, one of the byproducts could be swelling and muscle spasms. There's also going to be increased heat. And we found something right way down, way below, right there. Some things. How's this right over here?
Yeah, it hurts.
Right here.
Yeah.
Right here.
Yeah.
Right down here.
Yeah.
Which was worse?
Yeah.
Bottom or top?
The top.
Got it. That's that 4S. How's this? Not too bad, huh?
It hurts as well.
Yeah, but in relation to this one,
No.
which was worse? This one?
The middle one.
Middle one.
Yeah.
And this one, not as bad. How's this one here?
Yeah, it does as well.
But that's not the worst so far. How's this?
It pains. It hurts as well.
Hurts, but not as bad as
the second one.
Got it. And what about this one?
It hurts as well.
But not as bad.
Yeah.
Okay, so
Ah.
got it. So the fifth lumbar is a bit in trouble over there, but it's not truly fixated on that one. All right. I found a problem way down there, all right, at the fourth sacral segment level. So why is this an issue? Well, when we start piecing everything together, all right, you're leaning way over to this side, away from this area over here, all right? And in addition to, you're also talking about, okay, I got pain right down in the Achilles. I traditionally find that sacral nerve involvement is with this fellow over here. Now, you're also talking about, okay, I got problems, completing the job with the relationship with the wife. So why, where does that usually come from? Well, there's an old neurology mnemonic. Okay, this is what we all learn in neuro, that we talk about, okay, 2, 3, 4 lifts the Johnson off the floor. Okay, so it's these nerves, okay, the second sacral, third sacral, and fourth sacral nerves involves that innervates the plumbing equipment, right? Now the fact that, okay, we got a lot of swelling down here, all right, that could be the reason why you have a lot of trouble doing the task over that one, all right? So that's what we need to address. Well, yes, you do have a rudimentary sacral disc over here, and I just tested on you, right? This is something, it is swollen, and it's something we may need to address in a future visit. But no, right now, the one that's most acute on you is this one right over here, way down at number 4. You also have an old coccyx problem, because this one over here, it should line up with your sacrum. This one over here went backwards. All right? We're going to also keep an eye on that one too. This may be causing some instability to number 4 and number 2 as well. Right? But the more immediate thing is, again, it's this 4. This should be a straight line. As we can see over here, you're number 4, it's already starting to tilt this way. So the rest of your segments, everything else is starting to lean towards this way. Now, because of this old trauma you have in there that never fused and healed up properly, over here, and we have another problem over here, in essence, your foundation is doing like this, too much wobbly. Now, if the rest of the spine did not stabilize, the whole entire body is wobbling like this. So, with a normal movement in your lumbar spine, it should be like this. But your foundation is moving way too much like this. As a result, what happened is this ball bearing, it didn't like it. All right? Start to swell up, and that's what we see over here. This disc, the disc space, has increased compared to the other ones in relation. Therefore, this one, okay, is in trouble. Once we start stabilizing this, I would not be surprised this one start coming on quite a bit. Now, that being said, I still may need to adjust this after all. We're going to see after we address this one first. I know this is very swollen, very uncomfortable. I'm going to drop a little more. Keep on dropping. A little more. A little more. Breathe. Breathe. I know it's deep. Just breathe. Just breathe. When you're ready, come on up. Go ahead, walk around when you're ready. Do you need to clean? that's a good sign. Tell me, what's different?
There's much difference. I feel relief down the spine, man. There's much difference.
How much relief would you say from 0 to 100%?
Oh my God. I think like a 7/10.
So 70% improvement. How's your left Achilles? How's that feeling?
Yeah, initially the tangles I do have, it's reduced a little bit. So I think it has reduced a little bit.
How are things getting out of that table?
It wasn't that stressful.
Okay, try this. Go ahead, have a seat. Okay, then go ahead, come back up. Wow. How's that now?
Good.
How much improvement would you say for that?
Although I still feel the pain, but
I understand because there's still a lot of swelling in there.
yeah.
But how's it overall?
Oh, I'm a little bit relieved. I'm relieved.
Great. I also want to point to the viewers as you were walking down that hallway a bit, your body is finally starting to engage. You start to actually swing both left and right. It wasn't doing that before.
Yeah.
All right, so have a seat. Let's check a look. See what's going on with that fifth lumbar. How's this now?
I feel the pain, but not as much as
Not as intense as before.
yeah,
Right?
as the way it was before.
How's this one here?
Little bit.
See, this is your fifth lumbar. See, you're able to tilt completely to the right. See that? See? To the left, to the right. Oh, I like that. Right? Like I said, you're able to tilt completely to the left and right now.
Yeah.
Oh no, don't rotate because it's still very delicate. Okay? So as I explained before, it's because of all that massive instability in your foundation, it just disrupted everything in there. And like a domino effect, everything else above it was just moving way too much. And that's why your body was trying to lock up. That's why you felt all the muscle tightness in your whole entire back and soft. So this is what your homework's gonna be. I need you to ice the very bottom part, okay? It's right above your butt crack over there. 20 minutes every 2 hours.
20 minutes every 2 hours.
You got it. Because you gotta pump all that fluid out of there. Got it?
Okay.
All right, and I'll see you next week. Right?
Thank you, sir.
Oh, you're very welcome, man.
Thank you, sir.
Okay, sir. Give us the latest updates. How's everything coming along?
I've been much better compared to the first day I came, and I've been able to walk around. Although I don't walk for a very long distance, I can squat down and probably do some little movements. So I think I'm much better. The only pain I'm having now is the left butt.
Mm-hmm.
The pain goes down to my Achilles.
Okay.
Yeah.
That's still work in progress. All right. We'll we'll take a closer look at that in a moment. Also, how's the plumbing? How's that working along?
The plumbing is good. I did some exercise in regards to the finishing, and there's a good result.
Oh, so no more problem there anymore?
No. It's not as if there's no problem. There is, but I would say, I'm 75, between 75 to 80% to the finishing aspect of it.
Gotcha.
Yeah.
Hey, that's great results right there.
Sure, it is.
All right, well, thank you for the updates.
You're welcome, man. It's a pleasure.
How's this over here?
No much pain.
Not much, huh?
No,
How about here? Not too bad?
not too bad. Yeah,
Okay.
I can feel that. Yeah.
This you can feel.
Yeah.
Okay, it's your fifth lumbar. It's ready for correction. This is over here. Okay, walk around. Tell me, what's different?
Yeah, I can feel a relief on the lower back.
Okay. What about the problem go all the way down to your Achilles, the left
Yeah, it's
Achilles?
still, that is a major concern I have now.
Mm-hmm.
If I sit for long, for like 2 hours, I try to get up, I feel the pressure, much especially on my left butt down to the left leg.
I understand that. Okay, there's still some swelling in that area. So what I want you to do is this. I want you to ice your sacrum area, okay? Because it's still healing. Because all the indications that I'm seeing that it's in the process of healing. That's why we did not adjust it again. So ice is over here 20 minutes, 3 times a day. And the same thing as well, cover your 5th lumbar vertebrae as well. We had to adjust that one. That's also swollen, it's calming down. But as you see over here in x-rays, over here, see it over here? Everything's really leaning way over this way. So we stabilize your 4th, your 5th lumbar, we realign a little more, ease up some more pressure. It also is going to take some pressure off of your 2nd sacral segment as well. All right?
Okay.
Let it come down. We'll take another look at it, see how all this is progressing in the next visit. Right? Okay, you're all set.
Thank you.